Greetings and welcome. This is Dr. Lewis, and I am recording a brief introduction to evidence-based practice. I will state that I am not the author of this PowerPoint, and I developed or procured this module from the Academy of Medical Surgical Nurses. It's a very nicely done module on an intro to evidence-based practice. So why? That's the question. Why in the world? Well, nursing has a long history of providing excellence in care, but we haven't always had the science to back up why we do what we do. And there's a gap between the research and the findings that we're finding and actually doing them. So what we know, some things are done just because we've done it that way forever. Okay, so there is a gap between what we know and what we do. Okay, nursing practice can and must be changed from tradition-based to science-based. And an excellent example is my example of nitro paste, nitroglycerin ointment, that we used to apply to the patient's lower extremities if the patient developed a headache. Because the idea was maybe it's further away from the head and therefore will not cause as much problems with the headache. Well, it's still transdermal, it's still being absorbed, it's still a vasodilator, so all the things that contribute to the headache are still there. So that's one of those things that was a tradition-based thing that I practiced that I really don't think has a scientific basis. Okay. The IOM report recognized there were several competencies that were necessary in order to make sure that patients are getting good outcomes and safe quality of care. The competencies are in these areas: patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. Interestingly enough, a lot of these topics are the same topics that you're looking at in NUR 211. Coincidence? I think not. The purpose of the module is to provide an overview of evidence-based practice, which is one of these 5 competencies. Okay, and I will follow with the different objectives, which will also reiterate what's listed on this slide. So the idea is defining and recognizing the importance and the core competency of evidence-based practice. It's something that you need to know moving forward. It's something you need to have knowledge of in your interviews in terms of when you go to find a job, but it's also something that's going to be important as you progress in your career. Okay, identifying components of it, your role as a nurse, the steps, okay, writing a researchable clinical question and finding resources to find answers. Using clinical judgment, okay, in terms of when and how to integrate findings into practice. Some of that's patient-driven, because sometimes it's just not the right time to start integrating findings into practice, depending on the patient personal characteristics. So, evidence-based practice is knowing that what we do is the best practice. Okay, and you'll see this particular graphic occurs multiple times in this PowerPoint, but it's important because it brings you, as the individual and your clinical expertise, along with the patient's values and expectations, because it's not all about you. And I know that's sad, but it's true. As well as the best available clinical evidence, and the combination of the 3 should result in a better outcome for the patient. So, there's a question. How do we know in nursing? Now, as you progress in your education, especially as you get to the graduate level, that's a question you have to answer. How do we know in nursing? I had a master's level class on nursing knowledge and where do you get it? And I also had a doctoral level class in nursing knowledge. And as I recall, it was one of my first classes and it was a beast. Okay, but we know through a variety of methods. Okay, some of it is tradition. So you learn how to be a nurse based on the tradition of what you've seen and observed in others. Okay, that also comes into role modeling and mentorship, which is further down the list. Authority. You know in nursing because authority told you to know it. You know, you deal with that a lot now. Borrowing. Nursing borrows a lot of science from other disciplines. For example, pathophysiology. While nursing is essential for nursing to understand the pathophysiology of a disease process, it is a medical model. So it's a medically based science that we've borrowed in order to be able to provide the best care for the patient. I'm not saying that borrowing is bad, but it's not, that knowledge is not based in nursing. Sometimes trial and error. is how you end up with nursing knowledge. Some of the skills that I've developed over time, some of it's trial and error, and some of the shortcuts that you learn when I'm in clinical with you, trial and error. Right? Personal experience, just based upon the longer that you're a nurse, the more that you see, the more you do, that will help you to have knowledge and understand and know, as well as intuition and reasoning. That's one that's a little harder to define, a little amorphous, because sometimes you can look at a patient and just know. Okay? And you know that either it's going to be a really good day, or you know that that patient is unstable. And that's just one of those things that's your gut. And it's hard to put a definition, and it's hard to put defining characteristics on a nurse's gut instinct, but a lot of times the nurse's gut instincts are correct. Okay. And finally, nursing research is development of knowledge related to nursing. And this is definitely important as nursing develops as a profession. The types of nursing research that's out there, there's descriptive. So identifying and understanding phenomena and issues. So descriptive it's one of my favorites. It's not as vigorous or rigorous of a finding, but it's good because it basically helps you to understand. Okay. My doctoral project was descriptive based on concept-based curriculum and active learning strategies, and describing what was working and what wasn't working. Okay. Explanatory. So clarifying the relationships. For example, what is the relationship between the development of a headache after receiving nitroglycerin and the placement of the nitroglycerin? Predictability. In other words, you look at previous interventions and you look at the past and try to estimate the probability of the outcome based on an intervention. Or control. Control is when you manipulate the situation. So you have a group that is getting a treatment and a group that isn't, and you need to see what happens. There's something called a research practice gap, because we go out and we provide care for our patients. Much of what is known in research hasn't been applied to practice, okay? And that's changing very quickly. But it's known as the research practice gap, where basically we've been doing our thing, providing care for our patients, and yeah, that's great. But I'm too busy. I've got to provide care for my patients, and that's got to stop. In the 80s and 90s, they tried to do that by what's called research utilization. And it was a nice try. Okay, but it's development of research utilization projects, and it's almost like a precursor to evidence-based practice. Okay, and the idea of what was getting the knowledge out there, trying to get the findings synthesized into one conclusion. Critique of studies. It's important to be able to understand what is a good study and what isn't, because not all research studies are created equal, and some of them are not good. A perfect example is that study that came out about the vaccines, the original study, which was a bad study, and as it turns out, it was fabricated. So, there you go. Application of findings. Okay, it's taking the findings and applying them, and developing of research-based guidelines. So great, that's what we did. We had guidelines and knowledge, but the overall effect on clinical practice and patient outcomes is unclear. So we did make an attempt in the 80s and 90s, but we didn't quite get there, because when push came to shove, nurses were still doing what nurses were going to do. So they might have still been putting nitropaste on the patient's leg. Well, guess what? Let's do something about that. Now I'm going to have to research that to see if it's actually a thing. The problems of importance to med-surg nursing, such as skin breakdown, pain, bowel function, treatment adherence, and nausea, not always collected in the medical record. Okay, especially treatment adherence. That's not something you can always find in the medical record. Skin breakdown's a lot better than it used to be. Okay, so some of these are becoming more accessible, but at the time they really weren't. Nursing research studies are usually descriptive or qualitative in design. Okay, that's what I said. It's one of my favorite kinds. However, because qualitative research and descriptive research is a whole lot easier to do, so those of us that are in doctoral programs choose that, because most of us are working full-time and we don't have time to put towards doing a randomized controlled problem. And it's not as a rigorous or quantitative type research. So we need evidence-based practice. Okay, we want to strengthen the evidence base so we know what works and what doesn't. We want to standardize the evidence across fields. Put the evidence somewhere where we can find it and all have access to it. Translate and consolidate the state of the science into clinical recommendations. And that's what I'm seeing happen now, is that they're developing clinical recommendations that are actually based in science and not based on a gut feeling. And here's this wonderful graphic again. It's the definition of evidence-based practice, a problem-solving approach to clinical decision-making within a healthcare organization that integrates the best available scientific evidence with the best experiential evidence. Basically, that just summarized that graphic. The goals: to provide nurses with the best and the most recent important data, help to resolve problems and achieve excellence in care, help to provide some consistency in the provision of nursing care, because there's a lot of variations, and some nurses you don't want to follow. Promote effectiveness with nursing interventions, and assist with efficient and effective decision making. So helping nurses to make decisions on a more timely basis to possibly prevent complications. There's three main components of evidence-based practice. One of them is research evidence, the clinical expertise, and the patient values and circumstance. So let's talk about the levels of evidence. The highest level of evidence and the most strongest level of evidence is a randomized controlled trial. And that's when you have a group that gets a control, which basically is no treatment, and a group that gets a treatment, and you measure outcomes to see if there's any difference in the treatment group versus the no treatment group. Laboratory experiments are the next level. Clinical trials. Okay, epidemiologic research is generally looking at population-based data and trying to make an assumption or a conclusion from that. Outcomes research, and way down here is qualitative research. Okay, it is part of evidence, it's just not as strong. And then at the bottom of the research evidence is the nurse's intuition, which is always a little bit harder to justify, but there is something to it. Secondly, clinical expertise. Okay, you cannot look at evidence-based practice without looking at the expertise and the knowledge gained from practice over time. It's kind of like I used to sit in some things at work and know that they want to implement some new practice, and you go, that's just not going to work. And it's because expertise has told you over time that certain interventions are not going to work unless the system changes in order to allow it to happen. And then you have to take the patient into consideration. You can have the best of intentions, but the patient doesn't want to play, or the patient doesn't have the support system that they need to be able to adhere to whatever you're trying to implement. Their expectations may be different than yours. So, for example, their expectations for pain management may be different from what you're trying to apply with evidence-based practice. Okay. In research, the best nursing research is methodologically sound. It means it's a good study, clinically relevant, and about the effectiveness and safety of nursing interventions, the accuracy and precision of assessment measures, the power of predictive markers, the strength of causal relationships. In other words, does A actually cause B, or is it just a coincidence? The cost effectiveness and the meaning of illness. So those are the best research evidence that nurses could be doing. I did none of them, but I'm an educator, so there you have it. Okay, the nurse's role is participating. In other words, you can be a participant in terms of formulation of evidence-based practice through research. You can be a participant in that you utilize the current research in order to guide practice. Okay, in the med-surg nurses, surgical nurses must use research or use research findings in practice. That's part of the scope and standards of the med-surg nurses. So your role is to generate important questions. So you sit and go, I wonder why that is. Well, you just generated an important question, possibly. Know the basis for nursing practice. You have to know the scientific basis. Expect that evidence is the foundation of practice and participate in projects. Once you have it, you want to disseminate the project findings in various forms. Collaborate with the healthcare team to provide quality care. Okay, and there's 5 steps, and I hope I have time because this thing's about to time out. But the first step is, I wonder why that is. Okay, so you get a